Yeah, my name's Alan Emond. I'm Emeritus Professor of Child Health at the University of Bristol, and I've been involved with the children of the 90s since the very, very beginning. Well, first thing I'd like to say is thank you very much for participating in this gambling study. We had over 4,000 participants complete the gambling questions at each age, and that's been really useful because we've been able to look at changes over time. Well, the gambling study in our SPAC has come out of the work that we've been doing on risk-taking in young people. And gambling is an important part of this because it's increasing in young people and there's increasing concern about gambling related harms. The findings are that we've shown a transition between 17 and 24 in gambling habits, and as you might imagine, gambling frequency goes up over that time. And over this 8-year period we were doing the study, most of the gambling activity remained fairly static, but there was one activity which increased, and that was gambling online. And I think that reflects the general increase in use of online activities, the wider availability of smartphones and so on. I think the surprising thing is that for the people who had problems with gambling, we were only a small minority, 6 to 7%, that their gambling habits were established very early. There was very little change from the age of 20 onwards. So people who are regular gamblers, who are getting into problems with gambling, their habits are pretty much established by the age of 20. Very strong male dominance in this group, and it's associated with other risk-taking behaviours, with alcohol and drugs, and also with low mood and low well-being. So I think for a minority of people, young people, gambling is associated with other issues. Well, the findings are coming out at a very opportune time because there's recently been a House of Lords Select Committee on gambling related harms, and I contributed the results of the children of the 90s as evidence. So there's a big review at the moment going on about how to protect vulnerable young people from gambling related harms. So I think this evidence is going to help that discussion. I personally think that there needs to be more education in schools about gambling, about risk taking, about the odds of winning on the lottery or playing a game, and so that people can make a more informed choice. There's nothing wrong with gambling, it's a lot of fun and a lot of people do it without any harm. But there's a small minority of people, mainly young men, who are vulnerable and are increasingly getting hooked in by the online gambling. Now, online gambling is, at the moment, not very well regulated, and you only have to watch a football match and see that all the football players are wearing shirts with gambling companies on. In the half-time interval, the adverts are for gambling, and people put the odds so you can bet in-game. All of this, I think, needs to be better regulated because vulnerable people are getting hooked in to impulsively putting on bets, using a credit card, and that needs to be better regulated. So I think there's policy implications, there's regulation implications, and I think there's educational implications.